Today, we're diving into the world of health insurance in the U.S. Recently, I had to update my plan after a qualifying life event, or QLE. That meant exploring options like high deductible health plans, or HDHP, preferred provider organizations, or PPO, and health maintenance organizations, or HMO. Eventually, I landed on an HMO plan with a decent premium. But let me tell you, the process was overwhelming. And I know I'm not alone in feeling that way.
Health insurance in the U.S. is a system all its own. It's so deeply embedded in our society that trying to change it feels impossible and expensive. Like many of you, I had to figure it out while juggling other life responsibilities. Whether you're switching jobs, starting a new chapter, or just looking for coverage, it can feel like navigating a maze. Every time I opened the marketplace, I saw endless jargon and confusing descriptions. It was enough to make me shut my laptop and walk away. But when my QLE happened, I had no choice but to face it head-on. I spent hours learning terms like FSAs, HSAs, and how plans handle costs. That's why I've created this guide, to help others avoid the stress I went through.
I'm not an expert, but I hope to make these terms easier to understand. If you're shopping for a plan, feeling overwhelmed, or just want to know more, this video is for you. Let's get started with some of the basics. Insurance is about managing risk. Let's say you own something valuable, like a ring. You might pay a small amount to an insurance company every month. If something happens to that ring, the company will help you replace it.
Health insurance works the same way, but for your body. If you get sick, injured, or need medical care, insurance is supposed to cover part of the cost. But of course, it's rarely that simple. Let's start with premiums. This is the amount you pay every month to keep your plan active. Think of it like a subscription fee. If you don't pay, you lose coverage. And that could mean big risks.
Now, let's talk about deductibles. This is the amount you pay out of pocket for medical expenses before your insurance kicks in. For example, if your deductible is $1,000, you'll pay for everything up to that amount. Once you've met your deductible, your insurance starts covering its share.
Keep in mind, deductibles reset every year, often on January 1st, but some plans are different. Plans with lower premiums usually come with higher deductibles, and vice versa. It's a trade-off. You either pay more upfront or more when you need care. This is where the gamble comes in. If you're young and healthy, you might lean toward a low-premium, high-deductible plan to save money. But what happens if something unexpected occurs? Like a broken leg?
In Florida, for example, fixing a broken leg can cost anywhere from $2,500 for a simple cast to upwards of $35,000 if surgery is needed. Florida is one of the most expensive states for ER visits, so these costs could be even higher. With a high deductible plan, you'd need to pay thousands of dollars out of pocket before your insurance starts covering the bill.
To avoid that financial burden, you might consider adding accident supplemental insurance to your coverage. For around $100 to $120 a month for the entire family, accident coverage can drastically reduce your out-of-pocket costs. In many cases, these policies have a much smaller deductible, around $500 per accident, saving you from the shock of paying a $7,000 health plan deductible, for example. This small additional expense could be a lifesaver in an emergency, especially if you want peace of mind knowing you're prepared for the unexpected without breaking the bank.
For those under 30, there's another option. Catastrophic health plans. These have super low premiums, but very high deductibles. They're meant for emergencies, not day-to-day care. Next up, copays and coinsurance. Even if you've met your deductible, you might still have to pay a copay or coinsurance for services. A copay is a fixed amount, like $30 for a doctor visit or $10 for a prescription. These often apply even before you meet your deductible.
Coinsurance is a percentage of costs you pay after meeting your deductible. For example, If a service costs $100 and your coinsurance is 20%, you'll pay $20, and your insurance covers the rest. Now, let's add one more layer: the out-of-pocket maximum. This is the most you'll pay in a year for covered medical expenses. After that, your insurance covers 100% of in-network costs. But here's the catch: premiums, out-of-network services, and non-covered procedures don't count toward that maximum.
What's the difference between in-network and out-of-network? In-network providers have agreements with your insurance to offer discounted rates. Out-of-network providers don't, and that usually means higher costs. Emergency care adds another complication. You might not have control over the ambulance or hospital you're taken to, and many are out-of-network. Even in-network hospitals can have out-of-network doctors, like anesthesiologists. If your plan has a multi-tier network, it gets even trickier. Some in-network providers are considered preferred, which means lower costs. It's all about paying attention to the fine print.
Let's talk about the types of plans: HMO, PPO, EPO, and POS. An HMO, or Health Maintenance Organization, usually has lower premiums. But it comes with smaller networks, and you need a referral from a primary care doctor to see a specialist. A PPO, or Preferred Provider Organization, offers more flexibility. You can go out of network, and you don't need referrals. For that, PPO plans usually have higher premiums. An EPO, or Exclusive Provider Organization, is similar to HMO. They limit you to in-network providers, but don't require referrals for specialists. POS plans, or point-of-service plans, combine features of HMO and PPO. You need a primary care doctor and referrals, but you can go out of network if necessary.
Finally, let's touch on the acronyms: HSA, FSA, MSA, and HRA. An HSA is a health savings account tied to high-deductible health plans. You can set aside pre-tax money for medical expenses, and it rolls over year to year. FSAs, or flexible spending accounts, are employer-sponsored. They also use pre-tax dollars, but the money doesn't roll over. You use it or lose it. MSAs, or medical savings accounts, are for certain Medicare plans. They work like HSAs, but aren't as widely available. HRAs, or health reimbursement arrangements, are funded by employers. They reimburse you for medical expenses, tax-free, but you can't contribute your own money.
How about Medicare and Medicaid? They are government healthcare programs, and they work quite differently. Medicaid is for low-income individuals and families. It's run by each state with federal oversight, so benefits vary depending on where you live. Medicare is mostly for people over 65 or with certain disabilities. It's federal, so it's consistent nationwide. There are several parts to Medicare. A covers hospital stays, B covers outpatient care, D covers prescriptions, and C is private insurance approved by Medicare.
Navigating health insurance is challenging, but understanding the basics can help you avoid costly mistakes. If you're feeling unsure, consider working with a health insurance expert. They can help you pick a plan that fits your needs and budget.
Don't forget to like and subscribe for more content like this. If you have questions or want us to cover a specific topic in a future video, let us know in the comments. Thanks for watching, and we'll see you in the next one.